the accounting officer. Today it is quite funny, but well, I stand guided. Thank you. Yeah. To our accounting officers.
I'm Abraham Mabuto, the hospital administrator, Nyakach County Hospital.
Moving Okungu, the counter assistant.
Thank you very much, Honorable Chair. I am Dr. Edon Nyagudi, the medical superintendent, Nyakach County Hospital.
Thank you. Just proceed on taking your oath.
Thank you. I
kindly put your Bible up. Okay, just to justify your.
I, Mr. Edon Nyagudi, do solemnly and sincerely swear that every word that I shall utter before the Public Accounts and Investments Committee is the truth, nothing but the truth, and that every statement and declaration that I shall make shall be made conscientiously, believing the same to be true and according to the Oath and Statutory Declarations Act. So help me God.
You will have to sign. Thank you for that. May I confirm from the office of the clerk whether he got the responses on time?
Chairman, I confirm that we did get the responses on time.
Thank you. May I confirm from the office of the Auditor General whether they got responses from the accounting officers in time?
Chairman, we confirm that we received the responses in time and we are pleased to that effect.
Thank you. It is now the opportunity given to the auditor to confirm the auditor's opinion and what informed such kind of decisions. Thank you.
Yeah. Chair, the audit opinion for Nyakach Level 4 Hospital for the year 2022-2023 is a qualified opinion. And by qualified opinion, we mean that some account balances in the financial statements were not confirmed. And therefore, we have several issues that relate to that, which were not confirmed during that year. Thank you, Chair.
Thank you. And after having gone through the responses, we narrowed on some questions. Now we'll start with question 1.2. Then we go to question 3. Now to question 7. And finally, question 8. I hope you are taking note on that, everybody. And may I invite the auditor, office of the auditor, to start with question 1.2. Thank you.
Thank you, Chair. 1.2, variances between financial statement and supporting schedules. Review of the financial statements with the supporting schedule provided for audit revealed unexplained variances as tabulated below. Description: financial statement amount in Kenya shillings, supporting statute amount also in Kenya shillings, and the variance in Kenya shillings. Receivables from exchange transactions, National Hospital Insurance Fund, 2,716,690 in the financial statement, as opposed to 1,983,690 in the supporting schedules, resulting to a variance of Kenya shillings 733,000. Receivable from non-exchange transaction, Kenya shillings 1,550,000 is reflected in the financial statement, and the supporting schedules we had a nil amount, so the variance is 1,550,000. So in the circumstances, the accuracy of the above amounts and balances included in the financial statement could not be confirmed.
Back to the accounting officers.
Thank you, through the chair. We responded as follows. The management takes note of the variances raised and reiterates as follows. Part 1 was on receivable exchange from NHIF. So it's indeed that the receivable from NHIF as of 30th June 2023 was at 1,983,690, as supported by the schedules provided during the audit. The management commits to make adjustment to the financial statements for the financial year 2023-2024, which we did, to reflect the true receivables for exchange transaction. So the 2.7 that is quoted as in the financial statement was a misstatement. It ought not to be there. The correct figure was 1,983,690 Kenya shillings. Part 2 of the query was on receivable from non-exchange transaction, and we responded that it's true that receivable from non-exchange transactions stood at Kenya shillings 1,550,000 as at June 30th, 2023. And in effect, we have attached a TGS from the FMIS system, and the respective AI issued amounting to the amount issued on the amount indicating the funds being for the financial year 2022-2023. This was annexed. As at the time of doing the response, we did not attach the RTGS from IFMIS, but now we have it, and it is annexed. Thank you.
Maybe we need to give a direction. You don't need to add anything on top of your first reply, unless you are amending the report, which cannot be done. I hope it is very clear.
Thank you, Chair.
Don't add anything on top of that. If you have something, we'll give you opportunity now, you will have to expound. But read it as it is, it appears. Now, back to the auditors.
Yeah, management has provided supporting documents for receivables from non-exchange transaction of Kenya shillings 1,550,000 only.
Do you have something to say?
Probably there were two issues that we are to attach there, but I think you've guided us, you've guided me rather, on what needs to be done. Because in the response, we indicated that we attached the RTGS and the respective AI, but in the response, there's only the AI. We did not, at that point, did not attach RTGS. So I agree with what the auditors has said.
Maybe to ask, when we are talking about the receivables from non-exchange transactions. How did you get it 1.550? That is 1,550,000. But within your schedule, within the schedules, it is 0. How did you find this? Because it is the schedules which actually informs the financial statement and all those things. But within the schedules, it is now 0. It is indicated to be 0. But here, it is 1.550. Where did you get it? Is it cooked?
Thank you, Chair. The figure, the amount we are talking about here was meant for the year 2022, 2023, but the actual money came in July. The financial year had spilled. We had started a new year. That explains why it was 0, but it was money for the year that had just ended on June 30th.
You said that is the money which was?
The money was for the year, financial year 2021, 2022, but it came in July 2023. That's another financial year. It wasn't meant for that financial year, it was for the previous financial year.
But that is a balance carried forward if it is there. Probably if it was there. Now, there's also an issue which is there. We are talking, we have what is informing trial balance, what informs the statements and all that. At least you are getting them from the schedules. Now your schedule is indicating very clearly that it is 0 completely. How did you get 1.550? Because that is what should inform your financial statement. But it is 0. That is the question. Or maybe we can get guidance from the auditor.
Kindly.
From what through the chair, from what the MedSup has said, is that the 1.550 was money which was received late. If that was the case, then they should have passed a journal entry and indicated that this money is for the previous year, and then pay whoever was to be paid anything in the normal way and record it in their financial statements. They were to adjust the balances for the previous year by passing journal entry, and which they did not do. But according to what we saw, it was just nil. The SAGs were reading nil.
Maybe that brings us to a point where we ask, who did your accounting?
The financial statement were made by our accountant, Mr. Ezekiel Onunga. Unfortunately, he was supposed to be here, but seems not around.
So what was the contribution of the account clerk? I can see account clerk is here.
Yeah, the account class is relatively new.
I hope that there's a purpose why he's here. Because even if you came yesterday, you had to go through this so that you have something to say. Maybe that is for him, is the one to answer that.
I don't know if it's comfortable, but he can say a word.
And why is he here? You know, we must know why he's here. If he's relatively new, he has nothing to do with these statements. Why are you here? MedSup, that is not your question. Why are you here?
Okay, thank you, Chair. I'm here because I have also gone through the statements that though they were prepared while I was not there, but I can answer a little bit, 1 or 2 questions.
But that is the question I've asked. You should have asked. You should have answered. You don't need to say, you see, I can answer, I cannot answer. Why are you here if you can't respond? And if you can't respond, justify why you are here.
Okay, when I went through the financial statements, that money was for the previous financial year, but it reflected late, so it was captured in the next financial year. It was money meant for the previous financial year, 2021-2022, but then it reflected in the account in the following year, July of the following year, and the financial year of the government starts July 1st.
Obviously, where were you working? Because we don't need flower girls here. Where were you working before you came to Nyakach sub-county?
Previously, I was from the TRH, the Jaramogi Oginga Odinga Teaching and Referral Hospital.
What were you doing there?
I was there as an intern.
And now you are just confirm your position now. Are you confirmed as an employee of Kisumu County, or you are still an intern?
Right now, I am employed by the hospital, not the county.
Okay. Maybe admin, are you aware of this?
It is our accountant, Mr. Ezekiel Onunga, who was supposed to attach the ledger.
You honorable member.
Chair, picking from what the hospital admin has said, that it was the accountant who was supposed to attach the ledger. Let me agree with him and ask him over the same, that where was he supposed to get the ledger that he was to attach? You know what I mean?
You are given opportunity.
From the books of account, sir.
Who was providing Mr. Nonga the books of account? Because I know Ezekiel just roams around to support facilities, but all the documents are at the facility.
It is the admin to avail the books.
Did you avail?
Yes, I did. All the books were given to the accountant.
All the books were given to the accountant. So you are confirming that you gave him the books and he failed to attach. Do you have a copy of the ledger that you availed to him?
I didn't carry it with me, but it is in the office.
Why would you not carry it and you are coming to respond to audit queries? And that's one of the concerns of the auditor. I thought the reason of you coming here to support the in charge was to bring documentation that was requested that could not be provided for. It would have been easier if you told us, I gave the accountant this document to give the auditor. I did not, but this is the document that is required.
Sir, I didn't know Mr. Ezekiel was to be absent from this meeting. I was expecting him to be here with us.
But even in his presence, you are still the one in custody of the documents. Or is he the one now having all the documents of the hospital? Through you, Chair. Have you handed over all the documents of the hospital to Ezekiel Onunga?
Not so. I do hand over during the accounting purposes.
And then he brings them back?
Yes.
Did he bring back the ledger that you are talking about?
It was brought back, sir.
I raise my case, Chair.
Okay, we'll make a determination on that. We obviously proceed. The matter is not solved. Next question. Auditor.
The next question is item 3, unbalanced statement of financial position. The statement of financial position reflects total net assets and liabilities of Kenya shillings 21 183,622, while the total assets were 16,227,338, resulting in an unexplained and unreconciled variance of Kenya shillings 5,956,284. Therefore, an unbalanced statement of financial position. In the circumstances, the accuracy of the statement of financial position could not be confirmed.
Back to the accounting officers.
Thank you. Through the chair, the management responded as thus. The management acknowledges the issue raised herein and commits to make prior year adjustments to the financial year 2023-2024 financial statements when it will be revised upon review by the auditors from the OAG. That was our response.
Back to the auditors.
The management has not provided evidence on how the issue has been addressed. The issue has not been.
Do you have something to say?
Yeah, there's a imbalance between the net assets and net liabilities. Is I can say an error that happened during preparation of this financial statement by the accountant, and we went through it with him, and he was also not sure, but he was attributing it to the fact that there are some properties in those funds that are not valued, so he could not attach their value in the financial statement, causing this the variance, the unreconciled variance. So it's this is an accounting work that probably accountant will be better position to answer it, but now that is not here, the little knowledge I have is that, and what he told me that the variance arose because there are some PP is the plant, property, and equipment that are not, their value are not attached, so resulted to the variance.
Could you please narrow your response to KEMSA, because the value of drugs given to the hospital must be stated very clearly. They are quantified very clearly. Now the concern is very clear. Why did you not reconcile that KEMSA donation and such kind of things? It is called contribution in kind. Why did you not? Because you know the value. You must know the value. You can't be given drugs and you don't know the value of such kind of drugs. You know the value of those drugs. Why did you not reconcile?
Through the chair, I think these are two different queries that we are talking about. That the one you are talking about, KEMSA, is query number 2, but what we are responding is query number 3, if I'm not wrong.
Guided by the data. That is question number
3. It is true. It is true. They are responding to question number 3. But allow me to add.
Yeah.
When you receive assets, they are given us. If they are transferred from the county government, then there is a transfer deed, which lists the assets that have been bestowed in your custody. So from that transfer deed, you need to table your assets before the board or whoever is responsible for governance to give guidance on the values of those assets. So the values that are given in those transfer deeds or the values that are given by the board or whoever is concerned with governance are the values that you capture in the financial statements. And when the auditor comes to the hospital, then you give him those values, which he confirms with the financial statements. This did not happen. And when financial statements do not balance, then it means either there is a fraud or there is an error which materially affects the financial statements, and that financial statements cannot be said to give a true and fair view of the affairs of the hospital. Thank you, Chair.
Maybe if you have something from members. So the management must take caution on the kind of person doing your accounting. There's a problem. You just understand there's a problem. You can ask for somebody to help you, apart from the one you are using now. You see, you find he's doing that kind of work, but you can't arrive at an answer. Statements, all that, there are a lot of issues. So as much as you are trying to balance whatever you have, it is not possible for you to reach somewhere. Honorable Kumu.
Chair, this issue of KEMSA and them having the exact value of commodities that they are being provided for, we need to help them handle it, because I don't think it's unique to Nyakach. I have been to some of those facilities when KEMSA brings drugs. They come to you, they tell you, we are providing you with this, and this. Whether it was bought at 100 shillings, 50 shillings, 10 shillings or not, it's neither clear to the facility. So if it's being raised by the auditor, then I think we need to cascade it and talk to KEMSA, so that when they take commodities to our facilities, they need to have a value. So that if we lose those commodities, we can value them. If we use them, we can value them. If we were to get those commodities as a county, then we can know exactly what we are supposed to get should KEMSA not provide them. So as much as an audit query that is being raised for Nyakach, but it's a matter that I think we need to cascade as an assembly and as the county, so that it's clear that when KEMSA provide commodities, they need to tell us the exact monetary value of those commodities.
It's very clear, it is guided. But may I ask from the admin, do you always know the value of donated drugs? If you are donated, maybe the vaccines, such kind of things. Do you really know, or you just receive?
Mostly we do receive. Some have values and some don't have values. So as the Mheshimiwa has responded, we need to be assisted with the KEMSA on the valuation of their either donations or what they bring into the facility.
But how do you quantify what is given to you in the receiving end? Because actually you receive. How do you only talk about we receive a batch of some vaccines? How will you account for what is given to you? If however the donor or fails to do that, how do you do that? Because you are accounting, you are expected to account what you have. There's nothing free. If you are given something, you know, whoever gave you such kind of things, bought such kind of thing, it is possible. KEMSA also buys from pharmaceutical companies. There's nothing free. But it's now that you are getting it. You have never designed a way of probably estimating what you have, just estimating, even if you are not given the exact value. Yes.
No, the hospital thinks that KEMSA is doing us a favor by providing them with drugs. And every time KEMSA visit this facility, they handle them like some small god who has come to help them. I mean, we pay for those drugs. As a county, we pay KEMSA to provide those drugs. And we would prefer to pay for things that they've provided for. You know, as the truck moves, the truck will never come to the headquarters or to the assembly. The truck comes direct to the facility. And it's you to tell us that, yes, you are paying KEMSA to give us 1,000 doses of malaria, and they gave us 1,000 doses. If you receive them like they are helping us, then we'll be paying for 1,000 doses of malaria, and they are providing you with 200. So I would let the admin know that it's not a favor that KEMSA is doing to counties. We are paying for the services that they are offering, and we must account for those services so that we get value for money. Thank you, Chair.
It's very important. And again, now if you can't quantify, suppose the drugs are stolen and you are asked to quantify what is stolen. Doc, how will you handle that? Because you are confusing everything. Surely, you are given a bottle of water freely and it is 50 bob. You can't put or you are waiting for the police to come for investigation. Now that is the time you can put the cost of such kind of things. And that is also giving away some funny doctors to steal because they know very clearly that you are given freely. You see? That is quite unfortunate. So if you can come to the assembly and confirm that you are given some stuff and you can't quantify, you don't know the cost. What is that? Is that mismanagement or management? What is it? And drug is the most important so far. Even if you don't have the wards and people can be treated, you treat first, now you can refer to Jaramogi. And before you do that, you must use drugs. So surely you can be given a donation which is not quantified, and you use it that way. And if you get money from it, because we have FIF, where you plow back the money. When you plow back the money, how do you consider such kind of money? How will you know that whether you are making a move or not making a move? So why do you preside such kind of funny management style? Why? And why do you expect that we just flag off such kind of things without asking you people?
Thank you, Chair. I just want to make a clarification. The in-kind contribution that we usually get from KEMSA, they usually accompanied by an invoice and a delivery note. These things are monetized. The invoice has the price of the commodity that they bring, especially the drugs, the program drugs, that's ARVs and probably TB drugs and vaccines. They have money, they have their cost attached to them. So it's not that we don't know the value. When they bring them with the two documents. That's the invoice that carries the amount of the drugs, the cost of the drugs rather, and the total amount, and also the delivery note just to confirm. So when a consignment comes from KEMSA, we'll know that this consignment is this drugs and it's cost this much. We have those records. Thank you.
I think you should confirm. Admin, you just remind us of your name again, although it went through.
I'm Mr. Brahmabuto.
Are you working in Nyakach sub-county hospital?
Yes.
And what kind of answer did you give? I hope you are the admin. If you are the admin, or maybe we are misunderstanding the word of being an admin. If you can give such kind of answers, and I don't expect Doc to go and do most of these things. Maybe he can just check, but having you behind him is a blessing. But now you don't know the drugs are quantified when supplied to a facility. Because that was your answer. Are you really the admin of Nyakach sub-county hospital? And did you come here in that capacity? And you expect you give wrong answers and we praise that you appeared? Can you defend yourself? Because we need to make a ruling on you.
Sir, I think the MedSup has just given the right information I just said sometimes, or most of the times, they do bring the drugs, then later on they drop the invoice. But it is not the case. The case should be they drop in the drugs as they give the invoice and the delivery note. So I'm sorry for the first answer I gave.
Very good. But you have to know, these are MCAs. These are not councillors. When you come here, you must be ready with the proper answers. Most of these people you see here are learned and they understand what is happening. So when you come to the assembly, you must be ready to account and be factual on your answers. I hope you are guided.
I'm guided, sir.
We continue. The matter is unresolved. Back to the leaders.
Item 7, failure to remit statutory deduction. The view of casual workers master payroll revealed that contribution amounting to Kenya shillings 53,200 were deducted and not remitted to the National Social Security Fund, contrary to Section 19, subsection 1, and 20, subsection 1 of the National Security Fund Act 2013, which require every employer who under contract of service employs one employee or more shall register with the fund as a contributing employer and shall register its employees or employee or employees as members of the fund and pay to the pension fund in respect of each employee in his or her employment. The circumstances, management was in breach of the law, and this may attract fines, penalties, and interest, which are avoidable charges to public resources.
Back to the management.
Thank you. Through the chair. The management responded as thus. The management acknowledges the issue raised. The issue arose due to backlog of remittances to NSSF, and NSSF declined to accept further payment until the previous backlog is cleared. You have since signed a commitment with the NSSF on how to clear the backlog and regularize payment going forward, as was evidenced in Annex 5.
Back to the auditors.
Thank you, Chair. Management did not provide evidence to confirm that the statutory deduction is in arrears has been paid.
If you have something to say.
I will allow my colleagues to respond to this.
Oh, if you have, okay. If you have the answer.
Thank you, Chair. I think this issue we had gone to NSSF. Personally, I accompanied my admin to NSSF and we talked to a staff there and we made a commitment to pay. So the payment, the commitment to pay, we had to rebudget because the money was there. So we had to rebudget so that those remittances can be made. And going forward, we have already started doing as we committed with the NSSF.
Are you giving an answer in respect to the question? Is that what you are saying? Are you giving an answer in respect to that? It's just a confirmation. But
yes, because the question was asking about statutory deductions and NSSF and HIF. Those are the statutory deductions, if I'm right, Chair.
Now the 52 something, is it 53? This is the people's money, the employees' money. Who failed to pay this money to relevant bodies. You want to know? Was there by then? Is it the admin? Accounting officer? I can't just confirm. Who was misbehaving with people, employees' money in the facility? Because that is why we are here.
I said, these are NSF money that were deducted,
yes,
from the employees, the casual employees of the hospital,
yes,
but they were not being remitted to the NSF.
Doc, that is the question we are asking. You know what is happening?
Yes.
Now you are given money in the hospital, not in the department. You are given money in the hospital, and within the hospital now here, you fail to remit NSSF contributions of members. And you know this money is now, it has attracted interest. We want to know the person who was concerned so that we help the employees. Who was this person? Wachana story mingi. We have known, it is now audit query. Who was the person in charge by then? Who was it, the admin?
This backlogs stems back from 2021.
Who are the people?
And since then, there have been a lot of administrators we have had 3 administrators since then. So it cuts across.
So let me make a ruling. In 2 weeks' time, we want to know the people who are involved so that we charge this kind of people. They have to pay back the money. And before I conclude,
Yeah, Chair, I just want to understand why NSSF statutory deductions are being deducted and not remitted. Because I believe if you are able to pay the workers, it means you got money that you requested for payment, which includes statutory deductions. So do you use statutory deductions for other things, or why is it not being remitted?
I rejoined to that, Mr. Chair. Thank you, Mr. Chair. Mr. Chair, this is about both NHIF and SSF. And you know, NSSF is member saving. And they have said here, they have since visited the office of the NSSF and signed some memorandum on how to pay the backlog. 2 questions. 1, do they have proof of that memorandum here? And 2, these are monies that are supposed to, particularly in NSSF, these monies are supposed to generate interest. Is that memorandum will address the interest that this money would have generated to members because they have not been paid on time? Thank you.
be specific on the questions given by members so that we move ahead. Where is the evidence of memorandum you are talking about?
I think if I can start with the last question from Honorable Tom Onditi about the evidence that we signed with the NSSF. I think we have it's called a letter of, it's called undertaking. Letter of undertaking that was signed by my administrator here and the NSSF, where we committed to do monthly payments to clear the backlog, as also to regularize the payments going forward. And I think that admin is here. I can confirm to us whether is now doing the payments to NSSF, because this administrative duty that it should be able to clarify to us. But we have an undertaking that we signed pay in installments to clear the backlog, and also going forward to cater for that. Then there's the issue of interest. When you look at the contract that we signed, the undertaking, letter of understanding that we did with the NSSF, the amount is even higher than what is raised by the auditor, because the interests have accrued. So it's more than double the amount that we are talking about because of the interest, which we commit to pay. So interest is going to be catered for Mheshimiwa Nditi. There's a very hard question that Mheshimiwa Seth has asked. Why was this thing not being paid, yet it was being deducted? To be honest, I think if the money is being deducted and the money is there, you budget for it, you deduct it, but don't rate it. I think I will just say it's a bit of lethargy from the administrator who was working on this, because it was this work to do to remit. Thank you.
Have something?
Used and very helpful. Lethargy from the administrator. And sometimes I always insist that it doesn't make sense to bring administrators who are not there when such expenditures were being done. It's time we go for the administrator who was there when these monies were being deducted and they were not being remitted, Honorable Chair, so that we hold people accountable. There is a trend. Somebody does this mistake, he's transferred, they bring a new person like this one, he pretends he doesn't know anything, he's confused, he was not there, and then we pass. I think that has to stop, so that we don't incur. Imagine it's more than twice the amount that has been stated here because of interest. And yet, you budgeted for this money, it was given to you, you paid the salaries, and then refused to remit, and now it's accruing interest. I don't know what the money was used for. Maybe used for other good things, but now the cost of the interest is much more maybe than what you spent it on. So, yeah, and now we are even able to find money for the interest, and we were not able to pay deductions that were done from the money. Chair, I think that needs to really be addressed. Thank you. So I'm suggesting, Chair, we find this lethargic admin from wherever he is. If it's the one who is here, maybe we just need to confirm, is he the one sitting in front of us? Is he the lethargic administrator of Nyakach, or is he a different person? Thank you, Chair.
Well, this is one of the facilities we need to visit to confirm how they are operating. Because we also realize some of the issues we did not sort out here. We did not ask here World Bank financing a construction of a building, and it is left halfway. The CDF doing some other things. Those are not, we did not talk about that. And we need to look into such kind of things. But let me remind you one thing. If you are a holder of a public office, this is now Article 226 of the Constitution of Kenya, Part 5. If the holder of a public office, including a political office, directs or approves the use of public fund contrary to the law of instructions, the person is liable for any laws arising from that use and shall make good the laws, whether the person remains the holder of the office or not. At times, we have a problem with the people who are in charge of public resources, like you people. But I was surprised to find the admin, not the admin, but the accounting officer, who is the med soup, asking, let them tell us. You know, you came here as an entity. There's nobody different from this blame. But when we come to the facility now, we will now narrow on whoever did all this. It is your work, one accounting officer, to see that whoever is posted as an admin, whether it's the one messing up the system or somebody else mess up the system, it is your duty to account for whatever is happening within the facility. But that will not stop us from holding account clerk if he's the one misbehaving, because so far he has confirmed he's an employee of the county government. The other time we had issues concerning Kisumu Referral Hospital, where the interns were allowed to collect money, and instead of depositing money in the right place, they were swindling the public fund. I hope you are not one. And if you are one, if you go to Sub-County Hospital of Nyakach, kindly please behave, because we are coming for such kind of funny employees who are doing what is not expected. And we have now concluded that we need a report on who authorized the mischief in remitting the money meant for NHIF, so that we make such kind of person pay. Because I know very clearly you did not budget for this kind of payments you are making. The memorandum of understanding you are trying to make with the NSSF, that money which you intend to pay was not budgeted for. So we need to get that money, so that money meant to serve the public, to buy drugs and dressings, can be used in the right purpose, but not diverted to pay the NHIF, which was swindled by somebody whom we don't know. So it is better, after 2 weeks, you'll have to report back to this assembly on what you have done so far and who are the culprits. Thank you. Auditor.
Thank you, Chair. The next question is on weak controls in inventory management. The view of the hospital's inventory system reveals several weaknesses, which includes the lack of technical training for the clerical officer managing the store, the absence of large segregation resulting in lack of checks and balances in stock management, a non-automated store system compared to the unautomated pharmacy. Further, there was inadequate access control and security measures in the store area, absence of documented handovers when the storekeeper was absent. In addition, there was no evidence that an end-of-year stock take was carried out. So in the circumstances, the existence of effective internal control over inventories could not be confirmed. Thank you.
Back to the accounting officers.
Thank you, through the chair. The management acknowledged the issue that was flagged by the auditors, and the weak control inventory was occasioned by lack of a qualified supply chain officer. The Department of Health has since deployed a supply chain officer to run the department to help fill the existing gaps that was evidenced by the posting order that was annexed. That was our response.
Back to the auditors. If you have something to say,
Yeah, we went through this with the auditors, and they were helpful in guiding on what evidence that we needed to attach here. Because this was just one aspect of the issue that was raised. There are some issues that they were raised, were plugged, like the security of the store area, lack of evidence, there was no evidence of stock taking that was done. But I agree this was a weak response from us, but though the things that are queried, we've now put them in place, like India stock taking. Though at the time of making this report, we did not annex it. And also the issue of access, which we have also improved on by restricting the days for ordering commodities from the store. But this could not come out because we did not attach the memorandum that we sent to the departmental heads on when they can do the ordering of commodities from the store, so that you don't walk to the store any day at any time you wish. So I want to say that this is a bit the response we gave at this time was a bit underwhelming after we got the guidance yesterday from the Office of the Auditor General. So, thank you.
I think Nyakach Sub-County Hos'Ptl is not a small facility. It's a mother of all the facilities within the sub-county. And probably along the way, even if you have some accident or such kind of things within the system, I hope you recognize that you are a giant facility and you need a lot. But putting up policies which are guiding how you are operating and how you are doing your operations, does it require a department? Because even if within your home, you have to be getting a way that you can control whatever is happening within the home. Now, do we need an auditor to come and pinpoint that you can't do this, you can't do this? That's some things which are beyond your control, yes. You have to consult the department. But those that don't involve the department, what are you doing? And must you wait for the auditor to come so that now you talk of what we are talking about now?
Thank you, Chair. I think what I meant is that these things are there. Access, control of access. What is missing is the documentation part of it. What shows that we've limited the access to let's say 3 days in a week. Like you just say, it's a homestead. If you have your homestead, you have to put gates that nobody don't just get into your home through any porous point. So the evidence that is the gate there. Like now, that's our evidence was that now you need to have showed a memo to departmental heads, let's say pharmacy or lab, directing that now ordering the date for ordering commodities is maybe Monday, Wednesday, and Friday. In as much as there is practiced, but there was no evidence to support it.
Okay.
So that's what I meant.
Yeah, that is, with auditing, we talk on evidence. We don't just talk of hearsay, where somebody gave instructions, and you got there, you got such kind of instructions. You should be having policies guiding operations of the Hos'Ptls. Is it there in place now? Or what plans do you have?
I can report that it's now there, and when they came for the auditing for this one, these gaps are no longer there.
And because you have the admin, Hos'Ptl belongs to the admin. He has something to say. Admin, do you have something to say concerning that?
Yes, Chair. I just want to confirm that the policies are now in place, and moving forward, such queries will never be there.
You know, it is just a matter of having a paper. It is just a matter of having a paper. But is it going to be implemented? Is it something which will stand the test of time? Is it going to be a culture of the Hos'Ptl to follow? Whether you are not there, whether the med soup is not there, whether the account clerk is not there. You know, we are creating it for prosperity, not only for you people. And you know, when you come here, you represent an entity which is which will remain. You can go to district Hos'Ptl, next time you'll be in Razia, that kind of things. But that is now what the auditor was questioning, and that is our concern. So if it is in place, it is now in place, and the Hos'Ptl in charge of the hospital is saying, you are doing it, it is not in place, but you have started doing some other things. But you are saying it is in place. Are you reading from the same script?
Site is in place. What is remaining is just documentation, but practically we are doing it.
Bernadette, are you getting what our employees are saying? That it is in place, but there's no documentation. And that is the evidence you are looking for. And it is not there, they are saying it is there.
So that question came in the section of internal controls. Internal controls should be described. And when we read the description of those internal controls, we are able to point out that this is an internal control. For example, if you restrict entry, as you are saying, it must be somewhere in your description of the system for inventory so that we are able to pick it as an internal control issue. So if it is not written, then it is not there. That's our conclusion. So it has to be written, and it is not the responsibility of the Department of Health to provide you with internal controls. It is the responsibility of the management, and the management is the med soup and the management team at the hospital. Thank you, Chair.
Mheshimiwa, you have something to say?
Thank you, Mr. Chair. Mr. Chair, I want to thank the management of Nyakach Sub-County Hospital, and particularly the MedSoup. What I've observed here is that sometimes there was no, I don't know what they call it, internal or background consultation and concurrence with some of the issues that they were coming to address before the committee, because sometimes you realize the MedSoup and the administrator are speaking different languages on the same issues. Sometimes they're like contradicting each other. My advice would be sometimes it's good for them to have a consultation among themselves before they appear before a committee such as this, so that at least sometimes you may be saying the true thing, but you're saying it a different way, so that you know who will say what, so that there is consistency. Otherwise, because the entire team, the entire team should be either backing the leader, because you guys are one entity. I like what happened. Remember during the time the Jaramogi team came here led by Dr. Lesiampe. They were so organized that whatever somebody say, just build into what the other person said. So it's a teamwork. It's a demonstration of a teamwork. And we are not saying you've done wrong, but you've done so good. We just want to address some of the gray areas so that at least you speak as one team. Otherwise, thank you so much. And we hope next time you're going to be the best. Thank you.
I hope you are done. And just to follow what My member, the chair, is the deputy chair. It is very clear. Before we get into Kumbaya Hos'Ptl, we have to ask member of county assembly within that area. So before you came here, we were consulting a lot on members of county assemblies within the area, so that we get the background of what is happening. They told us a lot. Admin and MedSoup kindly see how to help the people while working together. The information on the ground is that you are not working together. That is the information on the ground. And that is why we are coming to visit you. The head of that institution is the MedSoup. You are the accounting officer. If you allow the admin to mess you up, you will be a government guest. Obviously, that is very clear. So if you allow probably any kind of mischief within the management, kindly please put your house in order, so that next time when you come here, we ask the area MCS, they will give a positive result on that. You know what is happening. And as admin, you have always been to several hospitals. You know, when you work in several places, you are experienced, and experience has advantage over others. So kindly please use your experience to help us service, give service to the people. And we have a young man who was just from District Hospital. You saw what District Hospital is doing. Kindly inject such kind of inputs so that you can help the hospital. It is not just a matter of accounting. You can see some of the issues you share with the administration, the admin, with the sub-county superintendent, medical superintendent. So it is always fine that you do it that way. The end result is the people. Even the auditors here, these are public officers. They want the best service for the people. The MCS, we want best services for our people. The governor, even the president. That is the only thing. It is the service to the people. So if you are given opportunity to be in charge of a facility where public is being served, kindly being a public officer, do what is expected of you, and go through the Finance Act. Yes. Public Management Finance. Yes. Regulation 15 is very relevant to the counties. Kindly please go through that so that you acquaint yourself with what is expected of you. Because most of these things will take somebody to jail, but we may not like somebody to go to jail. Just as I may not like myself to go to jail, I may not also like to facilitate you are going to jail, but I would help. So thank you very much. We appreciate the office of the data. We appreciate the office of the clerk and the secretariat and our visitors. You have tried your best. We know where to help you. And remember, we had a ruling on giving back the report on the 2 weeks' time concerning the issues which we actually discussed. Now, let me also announce before that we have our lunch. We prepare some lunch. Is it ready? In the next 10 minutes, kindly please don't leave. And to the members, we have Aero, Sub-County Hos'Ptl, as from TO. Thank you so much. A word of prayer.